over to you. Thank you very much for being with us today. Priya.
Well, thank you very much, Eloise, and hello, everyone. Very pleased to be here. I also see Bruce on the screen. So since it is actually quite an unearthly hour in DC, I'll try to be as coherent as I can, but I will also give the floor to Bruce to come in. We've been working very closely with the WHO on this endeavor. So he's as well informed on where we are as I am. So I want to thank the civil society organizations for very rich feedback and inputs along the way. And we've been working hard to incorporate your ideas, your suggestions, your views into the design of the fifth along the way, ever since we started getting your inputs through the white paper process. On the overall scope and kind of priorities, this is an area where discussions are still ongoing, and it's going to be something that we're going to be working on very intensively after September 8th, 9th, sort of between September and November, before we issue the first call for proposals of the fifth. But I can say that based on your feedback has really shaped our thinking, and broadly speaking, we heard from many of you that the focus of this fifth should be both on low and middle income, but also on just middle income countries. Low income because obviously they need support in strengthening their PPR capacities around the international health regulation standards, and these countries are fiscally stretched and they need support. But middle income because many of the past zoonotic diseases that have kind of ended up being pandemics have actually started in middle income countries. So those are high risk countries. So we've heard you, and the fifth is going to focus on both those sets of countries. Well, I should say 3 sets of countries: low income, low middle income, and middle income. In terms of the governance, we've heard loud and clear from you that civil society would like to have a seat at the table, and it's not something we've ever disagreed with. So very delighted to share that, as Eloise already mentioned, there are now the governing members, the founding members of the fifth have agreed on 2 seats, 2 voting seats for civil society organizations, and I think that will really enrich what the fifth does. But of course, we recognize that involvement of civil society doesn't end with those 2 seats. It has to be complemented with proactive forums where we can engage regularly with you all, with a broad variety of CSOs from all over the world, and get your inputs and feedback into the fifth. So we're quite committed as the interim secretariat. We're quite committed to doing that. I think I'll just stop there. And again, thank you. And we've taken on board your inputs along various streams, and looking forward to this conversation. And let me just pass on to Bruce in case, Bruce, you'd like to add anything. Thank you.
Is that okay, Eloise? A couple of words?
Yes, of course. Just a couple of minutes would be great.
Yeah. First, I'd just like to, again, join Priya in thanking all of you for all of the rich input. It's actually been fantastic perspectives. It's also been fantastic to see how you run a process and engage people through the CSO process, and quite frankly, very impressive across the board. I want to highlight that on the call as well are Jeremy, of course, from Welcome, and also Wolfram from Germany. So you have a couple of the founding donors that have been part of this process, and I think are important to help with addressing some of the questions as well. Perhaps, Eloise, have their perspectives, because they are the ones who've been listening to your voices. We are a channel to help execute, but it's really these folks who have been both so impressed and engaged. I thought, Eloise, maybe just to demystify a little bit the last 2 weeks since you met, there have been 3 or 4, let's say, intensive meetings of the founding donors. These are the meetings that Eloise was referring to. And these have mainly been focused on trying to sort out some of the nuts and bolts around what has to be in place to have the first board meeting, which, as most of you know, the dates have now been set for the 8th and 9th of September, half-day meeting, combination of in-person and virtual. And as you all know as well, there's kind of 4 pieces, like Priya explained the last time, that have to be in place. Things like the contribution agreements from key donors, the financial procurement agreements with the implementing entities, the operations manual, and the governance framework. So Eloise's point well taken about CSOs wanting to be in the room, but at this point, it's been very much, how would the donor constituencies be set up? How will they share the seats across them? Who's actually signed pledge letters? Should there be a minimum threshold for to be part of a donor constituency? Should the donor contributions be part of what's taken into account when there's voting? So a lot of it have been around the mechanics of how the donors will be working together. And I just think that's really important to be aware of, because that work would have happened regardless. There has been a lot of discussion about the importance of CSO voices and representation, as Priya said, and whether that should be 1 voting seat on the board, 2 voting seats on the board is kind of where the debate sits right now. The working proposal, like you said, Eloise, is that there be 2. And the other piece that they've been trying to solve for is, how do we make sure the balance of the donor countries and co-contributing countries, as we call them, or partner countries. And so as the time toward the meeting next week is very short, we've been trying to work out what's an interim arrangement to get representatives at that board meeting who would then run a process going forward to be able to get the permanent rep, so to speak, for the partner countries. And what we've agreed now is we're going to use the WHO regional structure as the basis for the non-donor seats. We'll have 3 seats in Afro, 2 seats in the Eastern Mediterranean region, and then 1 seat for each of the other regions. The interim rep will be invited on the basis, as Priya mentioned, of their IHR performance and progress on PPR, the knowledge really of these issues. And we will be inviting, even though we're using the WHO regional structure, we will actually be inviting health and finance reps, so a mix from the countries, to bring in that domestic financing angle, which will be so important. And we'll also have an arrangement similar to the what CSOs and others are proposing, of a lead and an alternate, so that if the lead is health from one of these representative countries, the alternate would be finance, or vice versa, to try and make sure we bring both of those perspectives to the table, because that's been such a powerful combination and so crucial in moving the PPR agenda forward. One last couple of points, maybe Priya, you should be the one announcing this, but really other news is that we are now up to 20 donors who have confirmed, 18 of whom I believe we have a pledge letter from, Priya, if I remember correctly, at about $1.3 billion. So still moving, getting a bit bigger, which is a positive development, as you know. And I think the other points we can address through any questions that may come up. I think, Eloise, those would be a couple of other points that I would mention. A lot of the work, as I say, has really been churning in the background, the bank doing part of it, WHO the other, on just getting basics like contribution agreements and the legalities in place with the donors, implementing entities, et cetera, just to be able to hold a board meeting.
Great. Thank you so much.
And I'm glad to see Priya still smiling, and that I didn't say anything that was completely wrong from her perspective, as well as Jeremy. But by the way, I should tell the CSOs, I now introduce myself as Bruce Aylward from the World Bank. I keep doing that by accident. So that'll tell you how closely we're all starting to work together.
There's a revelation. This is being recorded, Bruce. So a couple of questions for the Secretariat and also Jeremy Knox, who is kindly on point for welcome on behalf of the donors. So a question in the chat from Quentin. Is there a timeline for the publication of the first RFP and disbursement of funds? And before you come in on that one, a really important question from Elon, just to clarify from what Bruce said, the 2 CSO reps on the boards, is it a working proposal or has this been agreed and confirmed? So 2 chunky questions there.
I can take the RFP question. So the plan right now is that once the FIF is formally established, so let me just kind of maybe just go one step back and say, on June 30th, the World Bank's board approved the proposal that we put forward to establish the FIF. After that, in July and August, as Bruce mentioned, we worked intensively on putting together all of the constitutive documents of the FIF so that it can be established and can start receiving money from donors. That establishment will become formal through the first board meeting of the FIF. It's going to happen on the 8th and 9th of September. So the FIF will actually be created as a trust fund of the bank, and it can start receiving money. And then the plan is that between September and November, the FIF board which will comprise CSOs, will work together to define what the first call for proposals should be. In other words, what the design of that call should be, what it should be focused on. Then the FIF will issue, the board will issue the call for proposals. And then, there'll be, it's not been decided yet, but typically in FIFs, we do give at least 3 to 4 months for these proposals to be prepared and submitted. And so just kind of looking ahead then, the first disbursement of funds for projects that are that would benefit from the first call for proposals wouldn't happen till sometime in early spring of next year. So that's kind of the time frame that we're looking at. And by the way, I should have mentioned also that once these proposals are submitted to the FIF for funding, they'll be reviewed by a technical advisory panel on which the WHO will be playing a lead role, and so the technical advisory panel will be reviewing these proposals, and sort of based on agreed criteria, all of that will be made transparent. So in terms of disbursement of funds, again, probably sometime in the early spring of next year. So that's the timeline. I hope that that answers your question.
And maybe on the question of the CSOs, so it's a working proposal at the moment. The way we've been working with the interim secretary, it's been a bit of a challenge. We're trying to help the founding donors come to agreement on how they want to shape the FIF. It's their shape, it's their construct, it's their FIF. Our job is to help them move to, let's say, consensus on proposals. And so with the structure of the board where we are right now, the working construct is what we call a 9192 construct. So it's 9 donor countries, 1 seat for philanthropies and foundations on the donor side, so that's 10, and then 9 what we call co-contributor countries, which are would be receiving funds, but as well as making their domestic investments, of course. And then the working proposal is right now to have 2 CSO voting seats. So that's the working proposal. Now, the next time that will be discussed is tomorrow or Thursday. Thursday, when we will have the next meeting of the founding donors to try and lock in the final structure of the board. I think the real question at this point, Eloise, is will it be one voting seat or two voting seats? And frankly, you have a majority, you think, too, but there's a lot of work toward consensus building on this. Some want one, some are saying it's a more powerful voice if the CSOs are in a non-voting role. But this is where we're trying to establish consensus and working toward. Unless, Priya, you've heard something different overnight.
No, I mean, I just want to clarify that everything on the structure and governance of the FIF at the moment is a working proposal, because really speaking, it's only when the board meets for the first time that everything will be endorsed, and that's when the documents, the constitutive documents of the FIF get endorsed and by the board, and so that then becomes formal and final and endorsed. But I think the discussions, the way they're moving, and I'm sure Jeremy and Wolfram may want to add on this later, is that there's really very strong support amongst the FIF's founding donors for 2 CSO seats on the board of the FIF, so 2 voting seats. So I think that's I can say with a fair degree of confidence that's the way we're headed. And of course, as Bruce mentioned, we at the interim secretariat just facilitate and help, and the final decisions are made by the contributor group at this stage. So yeah, that's just kind of a little bit more color on that. Thanks.
Eloise, I think someone jumped on a
Yeah.
great point that I made. And if I said it's the founding donors FIF, that was not my intent. What I was trying to say was the interim secretary doesn't make decisions. It's actually the founding donors that do. So thanks for the correction on that. We need to see the FIF as a broader instrument working in everybody's interest to serve our goal of addressing critical gaps. Point really well made.
Yeah,
I think it's about the co-contributors as well, and the fact that it's about people on the implementation side, not just the money giving. We want to reform and reboot and completely modernize how we do all of these things, and I know this is seen as a big opportunity to do that. There are lots of questions in the chat. Technically, we've got a couple of minutes. I'm going to extend it a tiny bit further. I also want to make sure that Jeremy comes in on the donor front if he wants to. There are some yes and no questions here. For example, on One Health, will there be a space for CSOs on the technical advisory panel? I'm just going to run through some of these so you can, will there be, at which point will public inputs or feedback be allowed on the FIF's draft operating manual, eligibility criteria and monitoring accountability framework? Are there plans to include representation from other pillars of One Health in the governance structure, e.g. OIE, FAO, UNEP? And there's another sort of very straight up question: is there a draft board operating procedure or similar document that you can share with us? So could you answer those? Some of these we can take offline, but some of them are yes or no's. It'd be great to have quick answers from you on those. And then I would just turn to Jeremy for any thoughts from the donor perspective, if that's okay, Jeremy.
All right, maybe I could just take them quickly. One Health, yes. I mean, that's been a priority from the start. It's been something that we also highlighted in the bank's board paper, and so it's very much on the agenda, and I think the way it will be translated is eventually in the types of projects that the FIF finances, and so in the design and the designs of the call for proposals, which will kind of emphasize that as well. On the operations manual and governance framework, these documents are still being prepared as certain key issues get worked out. And the operations manual is a live document. So all these documents, when they get to a stage where they actually are coherent and make some sense, get shared, and the operations manual will be revised over time. So it will be made available, once it's in a shape that that you all can actually make sense, and we don't think it's kind of in a shape right now that's particularly helpful. And the governance framework is something that the fifth board will endorse at its first meeting, and again that will also be made public. Thanks.
Thank you. Bruce, do you have any more questions?
Yeah, on the question of the question of the TAP.
Sorry, there's just one more that I didn't underline, which was about joint calls for proposals. Would that be something that might happen in future? And there's a question about France as well.
Yes. So France is not yet part of the donor countries. We have certainly been advocating with them and engaging with them, and anything others might want to do in that regard is most welcome, with not only those, but others you don't see on the list that you think might be great to be part of the initiative. On the issue of the TAP is made up of individuals. It's not made up of constituencies. Let's be super clear on that. Now, as many of you know, WHO, who will be responsible for helping put together the technical advisory panel, has got long lists of potentially eligible folk based on technical expertise, et cetera, and many of those, of course, come from civil society organizations, et cetera. But the important thing to remember is you serve in an individual capacity on the TAP as a member of the TAP. So it wouldn't be like, okay, here's a seat for CSOs, run one of those fabulous selection processes that you do to get a representative, because that's not how the WHO technical advisory groups, which this is based on, actually operate. And that is a process that has been through, as many of you know, just years and years of development. But there are heaps of great CSO based folks who are members of different bodies. And as we put something together like this, we look for diversity. People are coming from different backgrounds, whether it's academia, programs, CSOs, et cetera. So, but just to be very clear, they wouldn't be there to speak for a constituency. It's really vetting the technical side as a technical expert and providing advice to the board on that regard. I think we've tapped most of the questions. Sorry, no pun intended, Eloise.
That's great. Thank you. I'd just like to turn now to Jeremy to give a perspective from the founding co-contributor perspective. Jeremy.
Thanks, Eloise, and thanks, everyone. So I think Bruce has laid out very candidly there exactly where we've got to with the formation of the board so far. And this really has been an iterative process over the past couple of months, with lots of very regular and very frank discussions between founding donors. From Wellcome's perspective, coming at this as a philanthropic donor, one of three currently, we have advocated at every point to make sure that really this is being set up as a board which does have a very strong balance, a very strong presence, both from CSOs and from co-contributor countries. We want to ensure this isn't an entity which is simply a vehicle for donor-led priority setting. This really needs to be something which operates differently and which properly takes on board the needs, the insights, the guidance of co-contributor countries, of beneficiaries, and of the CSO community. So I'm very glad we're getting to a point now where we're very close, I think, to reaching that consensus, that we should have this board which is essentially balanced between donors and co-contributors and CSOs, and we do have that presence in a voting form from two CSOs. I'm hopeful we'll reach a point where we have two voting seats for CSOs. I think it's important that we don't have a division between voting and non-voting CSOs, and I think two is kind of the right way to bring in that voice and to formalize that voice in the decision making for the board. But as Bruce and Priya have both alluded to, obviously there will be other means to bring in civil society voices, and indeed it will be important that the fifth is bringing in civil society voices and civil society insight in different ways, whether that's through the TAP or whether that's through a kind of general approach to continuing to listen around priorities. So obviously we kind of want to make sure that the consultation, the listening process isn't something that's restricted to this very rapid process over the summer. We want to make sure that the listening process goes on as we go through the priority setting and the development of the FIF over the coming months. Obviously, we're focusing on the FIF being up and running by next week. That's been a hugely ambitious target, but it's, I think, to the credit of donors, of CSO partners, and partners like PAN in helping us get to this point. But I think we need to make sure that actually we're continuing to do everything we can to ensure the success of the fund, and then in turn be able to bring on a wider set of donors. We have a good range of donors as it currently stands, but we need to make sure we can show early success and continue to bring more donors like France, like other major economies, like other middle-income countries as well. Make sure they can be brought on as donors and we can demonstrate success to them, and that this is a useful and powerful vehicle for them to be funding. I'll pause there because it's far more important we get on to the Q&A and hear much more from CSO partners, but very happy to take any other questions about Wellcome's perspective as a philanthropic donor. Thank you.
Great. Well, I think we've covered most of the questions which we asked to be put in the chat. If any more come up, we will ask people to direct them to the survey, and we will pass them on. And if they come up in the course of the conversation, we'll also let you know afterwards, and we'll keep this feedback loop going each time we do another round. So we're very grateful for your participation in that regard. So thank you very much for being with us today. We now enter the main event, the main reason we're here. So please do stay on and listen to the civil society inputs, and I will hand over to our moderator for the day, Dia Samnasi from CISDI, who will lead us through the rest of the day. Dia, over to you.
Thank you, Eloise. Good morning, good afternoon, good evening to partners joining in this second consultation, CSO consultation. The first one we had about 2 weeks ago, and now we are on to the second one. For those of you who were present during our first consultation, the rules are the same as laid out by Eloise. And the way that this consultation will be conducted is also the same. For those of you who just joined in this second consultation, please allow me a few minutes to explain what will happen during the course of the next 55 minutes. That is for discussion round 1, discussion round 2, and then I will hand over to Rafa, where we will do a short information session with regard to the interim CSO representatives issue. Please, next slide. We will divide the next 55 minutes into 2 rounds. The first round will discuss and consult and have questions and answers for the following questions with around the boundaries of scope of the PPR FIF. The guiding questions to think about as we go into the first round of discussion is: 1, what should be in scope for the PPR FIF and why? 2nd, what should not be in the scope and why? And the third questions will be: how can the PPR FIF scope and priorities legitimately fill gaps in pandemic preparedness at national and regional levels? I understand that from our perspective as CEO representatives, this third question perhaps have always been in the back of our minds, that ultimately we want to see the FIF and it can fill the gap of pandemic preparedness at national, regional level, and even down to the community. So I will begin with the first round with this, and then the second round later on, I will explain in detail also about how we are going to discuss about the priorities. So please raise your hand if you want to chip into the conversation. Turn on your camera if you can, so I can see you and call on your name. And as explained in the housekeeping rule, please keep to 90 seconds per intervention, so we can get as many inputs as we can, as many insights as we can. In some instances, I will perhaps follow up with the follow-up questions to anything that perhaps need more clarification. So please do not be alarmed of that. And then in the end of each round, we will put in a Jamboard. You will see a Jamboard, which is now being populated by my colleagues from CISDI as we speak, as we discuss. And then we will not really summarize, but point out on the keywords that we have been discussing and how we are going to formulate that into our input. So let's begin the discussion. Round one. First question will be, what should be in the scope of PPR 5 and what should not be in the scope? Please do feel free to mention both once you speak. And then third question will be, how can the PPR 5 scope and priorities legitimately fill gaps in pandemic? So please do specify to which points you are answering, and then so that it will enable us to take down the notes correctly. I see David and then Venus. In that order, please. Thank you.
Thank you. I'd like to primarily address the first question. The highest leverage pandemic risk mitigation activities are unfortunately invisible or less visible than response to pandemics. Specifically, prevention of outbreaks by reducing wildlife interfaces, or reducing the consumption of bushmeat, or reducing incursion into new areas, or anything similar that minimizes the rate at which zoonotic crossover events occur, end up with events that never appear. That there's no pandemic to stop. But the best way to handle disease outbreaks is to prevent them. Similarly, outbreaks which are quickly contained receive much less attention than those which are ignored and then spread before any control occurs. In both cases, we need to invest in civil society in low and middle income countries where most of the risk resides. The most visible events are failures when we need to respond. And we need to make sure that a fund like this doesn't spend all of its time, energy, and resources appearing to reduce risk instead of actually doing so. Thank you.
Thank you. Please, Venus. After that, Alison and Anna Marie.
Thank you very much. I'm speaking on behalf of the NTB Alliance.
I'm sorry, Alison. It's Venus now, and then you can speak after Venus. Please go ahead, Venus.
Venus, I think you're on mute.
You're on mute still.
Oh, okay. Sorry. Okay. I think one of the priorities that should be considered is looking at the impact of pandemics on women and children, the vulnerable populations, looking at the impact both from the health worker side and from the society side, because they seem to have to be able to suffer more from the effect of pandemics. So I think that's one of the issues, to say when interventions are being designed, they should take that into consideration. And just looking at what has happened with COVID, I think also one of the priorities should be looking at strengthening systems to ensure continuity of essential services, so that we can have, because now we are battling with, for example, in Zimbabwe, with outbreaks post-COVID, because we failed to sustain some services during the pandemic. And also one of the areas I think was mentioned is prevention. If you're looking at immunizable diseases, to make sure those areas are, but some of the pandemics will have cross immunities with other conditions. So if we're going to have robust immunization mechanisms, we can be able to strengthen that. And lastly, maybe I think there's a gap in terms of talking about recovery because post the pandemic, then there's that need to then look at the recovery side, because we're just looking at the response. So those are my inputs. Thank you.
Thank you. Please, Alison, and then Anna, Aida, and also Iolan after. Go
Thank
ahead,
you.
Alice.
Thank you. As I said, I'm speaking for the NCD Alliance. We wanted to bring up the case that the vast majority of the millions of people today who lost their lives to or became seriously ill with COVID had underlying health conditions, most commonly hypertension, cardiovascular disease, and diabetes. And in fact, studies have estimated around 60 to 90% of COVID-19 deaths have been of people living with one or more NCD. And well over a quarter of the world's population live with one or more NCDs, which puts them at a higher risk of COVID and types of diseases. Similarly, the disruption to essential health services, including to its workforces, has further increased the impact on already under-resourced NCD screening and treatment services. So, and it's revealed the shortcomings of a siloed approach to health governance and funding. And so in our summary recommendations for areas for funding that should consider includes improving population health more broadly, given this level of comorbidity and increased risk, tackling the structural factors underlying COVID-19 and NCDs, including poverty and inequalities and barriers of access to healthcare, building more resilient health systems, tackling the preventable harms that increase the risks of NCDs and vulnerability, such as tobacco, alcohol, healthy diet and drink, and also trying to build on the transformative impact from some of the NCD innovations, including resources and technology mobilized during the pandemic. So yeah, I'll leave it there. Thank you.
Thank you. Please, Anna.
Hello, my name is Anna Mary. I'm from Brook, based in the UK, and I also represent the Action for Animal Health Coalition that Brook is the secretariat of. So in terms of the scope of the fund, it is crucial that the pillars of One Health, so human, animal, and environment, are included equally. Let's remember that 70% of emerging human infections come from animals. It is therefore vital that the new fund focuses on preventing zoonotic spillover. That means investment in strengthening health systems, including the animal health system, which is arguably currently the weakest link in One Health, definitely in terms of investment and funding. Thank you very much.
Thank you. And Aida, please.
Hi, good morning, good evening, good afternoon to everyone. Aida Kurtovic from Bosnia and Herzegovina. Thank you for the opportunity and thank you for having this call. So in terms of priorities or scope for this fund, there are two areas there. One is what we should not have and that we should not see, and that is further deepening of donor dependency. So what we would love to see here is having a fund which would have a catalytic effect in countries, unlock domestic investment into the pandemic preparedness, prevention, and response, and do that in continued and systematic way, keeping these topics relevant, because they will not be relevant 5 or 10 years after COVID if there is no other, hopefully, if there is no other global health issue like COVID has been. Also, what we want to see is having this fund to help us to learn the lesson that we seems to be failing to learn all the time, which is the global solidarity. So I'm hoping personally that this fund will help us to learn more about global solidarity. So to use globally available vaccines, drugs, protective tools, whatever they are, in better way, which would be more efficient in responding to pandemics instead of focusing only on well-developed countries who can afford these. Thank you.
Thank you. Before we proceed, I would like to remind and encourage colleagues joining in from the Asia time zone to also please give in your insight. And there is one point of question that I also invite colleagues here to answer is the third point. How can the PPR fifth scope and priorities legitimately fill gaps in pandemic preparedness at national and regional levels? Please do as you prepare your intervention to also give an insight on that question, point number 3. Thank you. And now, Iolen, and after that, Marisa.
Yep, sure. Thanks very much. My name is Olin McFadden from Frontline AIDS. So in the first 2 points, which is related to what should and shouldn't be in the scope for the fifth, building a little on what Ida has just said, I think in order for that the fifth can support and build on pre-existing structures and responses and avoid any type of replication, the scope of the fund should aim at acting as a type of catalytic funding rather than creating anything brand new. And similarly, the fifth should not lead and direct the direction of PPPR work. That those sort of decisions on what and where to direct funding for PPPR should be led at national level. And by this, I mean national level stakeholders as a whole, not just necessarily country level government reps. And in terms of the third point around how can the scope and priorities legitimately fill gaps in pandemic preparedness? In the Global Fund's operations as a pandemic fifth for the past 20 years, they've developed a conception of wider sustainable systems for health rather than a narrower focus on traditional primary healthcare systems. So in order for this new fund to also effectively fill gaps in pandemic preparedness, it would need to have a similar conception of a wider health architecture and look to supporting the creation of legal frameworks, supply chains, or other systems that would be needed to create those type of effective pandemic responses. And then, yeah, just briefly to say, building on that, as co-host for the fund, I think the World Bank could address many of these gaps by building on their own global health sector strategies that they've developed around HIV. These have been developed over many years and are focused on addressing pandemics using a people-centered approach that is sort of building on shared interventions to strengthen these type of wider health systems that are needed to respond to pandemics. So thank you very much.
Thank you. Please, Marisa, and then George.
Yes, thank you very much. So I will just build on what has been said. So my name is Marisa Pey, and I represent PRESOD initiative, which is a research-led, scientific-led initiative to prevent emerging disease pandemics to occur. And one thing that we have learned as researchers in the research field for the past 20 years is that there is a need to really promote the translation of research outputs to concrete actions and to really facilitate and promote this discussion and permanent dialogue between research, civil society, and policy. And I think this is something that really should be strongly in the scope of the fund as well. And also to ensure that the solutions that are being found and funded by the fund so will be built based on what is already existing, and that has been strongly emphasized so far, but also should be built based on a bottom-up approach. They need to be contextually relevant, and to ensure the autonomy of the country and to make sure that the solution for pandemic prevention will be sustained in time, because it has been highlighted already, but it's important to emphasize it, that prevention needs to be funded forever on a long-term basis, because and it will be difficult because this is when nothing is happening that prevention is working. So, but to ensure that and ensure the autonomy of the country that are implementing the solution, they should be developed and built up with the people that are implementing them at the local level, and of course at the national level, to ensure that they are integrated and fully funded eventually by the national government in their regulation and national policy. Thank you very much. And I would be very happy to discuss with the Pandemic Action Network and the fund to see also how PRESOD can support that, and how we can also try to to promote friends engagement at some stage. Thank you very much.
Thank you. Thank you very much for your intervention. And now George and Taremwa.
Thank you, moderator. Can you hear me? Hello?
Yes. Yes.
Hello? You can hear me?
Yes, we can hear you. If the bandwidth is not, the signal is not good enough, please just turn off your camera. That's fine.
Okay. Financial Intermediary Fund, scope and priorities, legitimately fill gaps in pandemic preparedness at a national and regional level. I think that for the scope and priorities, legitimately can be filled at the national level, especially if our governments can spend less on military expenditure and divert much of the resources that are invested in military expenditure to health systems. Because as much as we want, we shall need money to be able to, for the PPR, Financial Intermediary Fund, to work. We shall need money. And we can get a lot of money to be able to realize the objectives if military expenditure at national level is reduced. But when you look now at the different governments in the world, they are increasing military expenditure and reducing expenditure in other areas. So that is my take.
Thank you. Thank you, George. Let's move to Taremwa and then Anthony Ombara. I encourage colleagues who work at national and regional level to think about the question number 3, which is the how can the scope and priorities fill the gaps in pandemic preparedness at national and regional levels. I think easily put, this is how what must be done so we do not repeat where we were when this pandemic started. From civil society perspective, I think everyone here can provide an input and insight on that. We still have a good sized amount of time to revisit question number 3, but please from Taremwa and then Anthony. Go ahead.
Yeah, thank you so much. My name is called Local Sustainable Communities Organization. It works a lot on human rights advocacy, and health is part of the work that we do. In what we've been doing, especially through the pandemic time, we've realized that accessibility to health services has been a challenge, and most importantly, to the rural areas, because we are community-based. In the rural areas, the accessibility to services has been challenging, and so we need to bring to speed, especially the village health teams, to understand clear population. And then another thing is about the integration of sexual reproductive health rights in programming. That is also another area that has been lacking. It is also challenging in Uganda here because recently that is being discussed, that should be, but it is also being challenged because not many people understand the importance and the spirit behind that bill. So my take would be that, and we sensitization and also do market, and so that importance of that it is also being affected by the majorly the women and the children, and that needs to be averted. And as LOSCO, we've been doing it from the voluntary aspect, and we've been getting partnerships, much as they are not financial, but as long as they are activity-based, and then we reach out to communities and bring them to the understanding of what needs to be done at a particular time, then it is.
I'm sorry, Taremwa, you are breaking up.
Is always the way to go. Thank you so much.
Yeah, thank you, Taremwa. We hear you partially. You were breaking up in few parts. So please do put in your insight or input in the chat, or you can also send us the written input in the survey link that's provided by Rafa in the chat box as well. Thank you. Anthony and Ulrich, and then I would like to invite colleagues in the chat who have made interesting comments to clarify and to explain, please. In the chat, I see Quentin from GFAN. Can you please make a comment after Ulrich? Thank you. Can you please speak after Ulrich? Thank you. And Anthony?
Thanks. On number 2, I think for me the funds should focus on rehabilitation of the global health priorities, considering the SDGs are halfway met, and considering the pandemic had massive disruption in terms of universal health care. So how can we rehabilitate the commitments that were made in the SDGs 2030 towards universal health care, and more so in terms of preventing more backsliding and ensuring catch up for primary health care, especially in the low and middle income countries. In terms of how the fund can support national and regional systems, for me, I think the fund should focus on investing more in terms of stopping localized outbreaks from spreading, and putting more emphasis on strengthening emergency operational centers. For me, from an African perspective, how do we support efforts by African governments in terms of regional and sub-regional emergency centers? How do we support national public health institutions and communication networks, and ensure simulations and pre-agreed response protocols? And then lastly, for me, I think the funds should also support a bit of building and enhancing system strengthening in terms of capacity to respond to emergency, ensuring preparedness, including surveillance in low and middle income countries, and more so just building systems that will ensure richer and involvement of communities, because you've realized during the pandemic, most communities were left out. So how do we enhance more of community engagement, but also reaching and ensuring that community become involved in the emergencies and not being locked out, as was the case before? Thank you.
Thank you. Please, Ulrich, and then Quentin. Colleagues, this is a reminder to keep your intervention at 90 seconds, please.
D'accord. Je vous remercie pour la parole que vous m'accordez.
I want to thank you. I am Ulrich. En ce qui concerne sur les concerning the NGOs, I think that the fund FAIF have to be oriented to surveillance, epidemiology surveillance, because in low-income countries, the fund for the communities have to be implicated in supply chain. I think the fund have to be 3 possible actions: the reinforcement of the health system locally, and reinforcement of in framework of the epidemiologic surveillance, and also in the frame of the budgets allocated to supply chain of essential drugs in the communities. I think there should be the main focus. Thank you.
Thank you. And now Quentin. And afterwards, I would like to invite colleagues who have made some comments in the chat box with regard to question 3. Please, I think that is Linda and also Marisa. Thank you.
Thank you very much for giving me the floor. What I wanted to point out is the importance of having a conversation on the 3 pillars of Plan 5. Prevention, preparedness, and response. Discussing not only the value of investment in each of those, but also capacity for impact. There's a risk of, in particular, I think this is a question around prevention. One of the recommendations of the independent panel for pandemic preparedness was that the risk of putting too much emphasis on prevention was to dilute the impact of the fund, because prevention covered just a very wide range of activity and priorities. Whether that is true or not, I think it's an important question to consider. Not just, of course, it's always better to prevent diseases, but it's also important to account for the fact that some investments are more impactful than others, and it might be easier to plan for to invest into preparedness and to prepare for response rather than preventing. And wanting to add that I think dismissing the role that the new fund could have in response is, I think, is unwarranted at this point. It can be set up to be flexible and to bring investment quickly. This is, design phase, so everything is still possible. That is all for me.
Thank you for the clarification. I see Elia and also Dose. Please, Elia.
Oui, merci pour la parole.
Thank you for this. I wanted to continue what being said. Of my interest is exactly the organization, local organizations, the CSOs, if possible, to facilitate the emergence of aware situations. I'm sorry.
Yes, Elia. Please continue speaking. We can hear you. Okay, apparently there is a technical problem, so we will move to Dose for now, and then we can re-invite Elia to finish his intervention later. Please, Dose.
Thank you very much. You know that concerning the fund, I think that we can have social action, and from this perspective, there is zones that are implicated in the social protection and are obligated to include everybody. Concerning the supply chain and the to promote health for starting from the local governments that are obligated to establish a community of local development. So starting from that, we have to assure more about that. And thank you.
Okay, thank you, Dose. And I see Guy. Please go ahead. Guy, yeah. Please go ahead and give your intervention. You can speak after you unmute.
Oui, bonjour.
Hello.
Bonjour.
Ok, donc moi je suis au Gabon, je travaille.
So I am in Gabon and working over TB, and I'm in charge of the diseases control and also national consultant
Des questions qui sont de santé comme
inside the CCID. Here in Gabon, we don't have a health system like in other countries developed like Burkina Faso, Senegal, or Mali. We have several entities, but I'm now concentrated on the question of transfrontier health system. So the Cameroon is the country who have incidents of tuberculosis and HIV, and what we can name the high body like TB and HIV. There is some control, frontier control that include the vulnerable populations that are the frontal border population that are the most vulnerable, like families in the regional countries. So the focus to have these communities and reinforce the health system to reduce the incidence of these diseases for these particular vulnerable groups, to inform them and make them the actors of their own health. Thank you.
Thank you. Thank you for your very insightful interventions, colleague. We are approaching the end of discussion round 1, and I would like to ask colleagues to put up the Jamboard so we can see some keywords that have been discussed, and I will try to recap our discussions that we just had. While we wait for the Jamboard to be put up, I would like to note that with point number 1, we have received so many insight what to be included in the scope, and should have gender lens with pointing out to the vulnerable population and the greater population at risk. It should ensure recovery is being regarded for post-pandemic, being transformative, have one health approach, underlying catalytic effect, and unlock domestic investment in PPR. It should be able be a learning mechanism for us to ensure global solidarity, sustain funding, not just one time, be based on SDGs and the global health as priorities, to be inclusive, to put more focus, of course, in the LMICs, with the focus in rural areas and vulnerable population as being as mentioned before. What it should not include is the silo approach. It has to be able to reach the whole population. It should not be donor dependent. It should be able to be independent enough to have its own system and the mechanism. And then to fill the gaps, it should focus on the strengthening of health system, catching up on the primary healthcare. This is question point number 3, catching up on primary healthcare strengthening. It can fill the gap in the system, the overall health system strengthening, and it should be based on evidence-based approach. That's the gist of what we discussed in discussion round 1, and this is what you see in your screen is the what we capture in the Jamboard. So social protection, invest in CSOs, in LMICs, it should reduce risk, and also put research into concrete actions are among the key insights that you have presented in this round, the first question. Now we move to discussion topic 2. If colleagues can put up the slide, please. Here, we will discuss the initial RFP priorities and white paper. For context. This allocate financing where investments are most urgently needed to bolster PPR and plugging in key capacity gaps at all levels. So it should strengthen country level PPR capacity, build regional and global capacity, and support technical assistance. In this discussion too, I will ask three guiding questions. Slide, please. We move to next slide, or 2 guiding questions. What are the key priorities that should be defined in the first round of funding from the PPR 5th? And what are areas that should be deprioritized in this initial round? So this is where I will ask you to really prioritize and what should be deprioritized in this initial round. So it's limited by time initially in this first round that we are going to have after the 8th and 9th of September. What should be in it? What are the priorities that should be included? But what should be deprioritized from this initial round? I again invite colleagues to raise your hands and open your camera if you are going to speak. I see colleagues from the Asia side of time zone. Please do feel free to jump into the conversation and discussion. Waiting for colleagues to raise their hand. We have roughly 25 minutes for this discussion before I have to hand over to colleagues from PAN. Anybody would like to jump in, or am I would like to invite colleagues from who haven't spoken, but please do feel free for colleagues, CSO colleagues who have spoken in the first round to also give your input in the second round of discussion. What are the key priorities and what should be deprioritized for this initial RFP that is going to be issued very, very soon? Please do think about your work at national or regional level and build up from there. Eolen, please.
Yeah, sure. Just maybe in terms of key priorities that should define the first round, kind of to repeat maybe what I'd said earlier, but it should sustain and scale up pre-existing infrastructure, in particular existing pandemic infrastructure from the HIV movement and other pandemic responses as a priority. This has been touched on by the speakers at the start of the call as well, but in terms of the selection of countries where the funding should be allocated, it will be really important for the CSOs and communities to really feed into the criteria for that, and that CSOs should also be participants in the selection process itself. In terms of what should be deprioritized for this initial round, I think occasionally with these type of funds before, we've seen quite a large focus on infrastructure building in terms of creating new physical spaces or medical centers. I think it would be important for this particular fifth if we would deprioritize this type of infrastructure building and instead focus more on supporting access to technical assistance, system strengthening, scenario planning and contingency planning around pandemic outbreaks and forms of support such as that. Thank you very much.
Thank you, Eolen. Nahashon and then Ida, please. I see colleagues from Japan and Singapore. Please do take the opportunity to jump in also into the discussion. Thank you. Nahashon and then Ida and Venus.
Thank you, Indonesia. I don't know why my name picked Nahashon, but this is Mlewa. Yes, so I think what we need to prioritize is this fund should prioritize community surveillance, that's a very key critical area in pandemic preparedness. And I think as this fund focuses much more on community surveillance, then it would be easy to actually pick early warnings of any pandemic that comes up, so that it can actually be able to be managed and maintained, and then it doesn't bubble out. So community surveillance is a key area that this fund is focused on. Thank you.
Thank you. Ida, Venus, and Anthony. In that order, please. Thank you.
Thank you. So I think after a recent COVID-19 pandemic, we have a pretty good picture globally of the preparedness of each country and each region. So what I believe is very much needed right now is to have targeted interventions into those areas that have already confirmed to be weakness for the specific countries and for the regions. If I think what are these areas, I would take two. The community engagement. There has been too many national responses to the recent pandemic without the community engagement. And that has resulted, unfortunately, with unnecessary suffering of many communities, including people living with HIV, who have had challenges to access the services which they needed. On the other hand, the lab capacities, so early warning systems, surveillance systems, appear to be technically lacking capacity or other parts of the response which would be needed for the timely and properly functioning of these. So these are two critically important pieces right now. Thank you.
Thank you. Venus?
Thank you. Thank you. Just looking at the priorities, I think I would want the community engagement to be strengthened, because that would allow us to quickly detect outbreaks and be able to put in measures before they spread. And also I'd like to talk to the issue of commodities, supply chain management and provision of commodities for response to the outbreaks themselves and the other disease conditions. Just looking at the disruption that happened in the supply chain, where there is also need for that to be strengthened, look at existing structures and make sure countries have capacity to produce some items, or then strengthen the global supply chain and logistics management. Thank you.
Thank you. Please, Dose and Anthony, and then Usudin. Dose?
Oui, Dose. Dose, ONG a tête du Togo, et je reviens encore pour préciser que la priorité.
I wanted to precise one more time that priority is concerning the multilateralism that is really important, that is the pillars, the necessary the pillar on the national level and local level as well, in a multilateral way, and the governance will be more transparent in assistance of diagnosis on the national and also local level to satisfy the local environment. Thank you.
Thank you. Anthony, and then Usodinma.
Merci, Anthony. Et puis,
I think for me it's more in terms of advocacy efforts towards health financing. For me, I think considering that the pandemic really exposed our health systems, and even the ones that seem to be stronger were exposed to be vulnerable. So how do we support more efforts in terms of advocacy towards health financing and ensuring accountability? Thank you.
Thank you. Usodinma, and after that, please, colleagues who give in your comments in the chat box, if you can and would like to speak, please do raise your hand and speak after Anthony. Thank you.
Thank you so much, moderator, for the audience and allowing me to speak. I From our perspective, my name is Uzodimma Adrieja. I'm the CEO of AfriHealth Optonet Association.
Mr. Dinma, is it possible for you to speak louder or closer to the microphone, please?
All right, thank you. My name is Dr. Uzodimma Adrieja. I am the CEO of AfriHealth Optonet Association, but I'm joining from Nigeria. From our perspective, I think we should lay emphasis on scaling up current interventions as well as the capacity of civil society organizations to build lasting partnerships and collaborations for intervention, to be able to engage in advocacy, not just within and among themselves, but among stakeholders, government and funders, as well as some social mobilization activities among those affected by disaster, as well as data collection. Most of the things we say, even in developing countries, data collection is difficult. Availability of real-time data for interventions and planning is difficult. So that is necessary. Our capacity needs to be built either directly by training or whatever way. And then for some communities where civil societies are actually active, they can be supported to engage in outreaches. Outreaches can be opportunities to provide needed health care, provide counseling, provide succor, share emotion. And then that will also be helpful to involve civil society and communities in monitoring what is being done, ensuring that actions are being taken as planned, and if need be engaged in evaluation. Thank you.
Thank you. Thank you. Anthony and then Marisa, please. Okay, so Anthony is not speaking. Marisa, can you please take the time now to speak?
Yes, sure. Yeah, I just wanted to emphasize that in order to, the key to prevent pandemic to occur and disease to emerge is really to engage local actors in the actions, and those actors that are at the front line with risk. So they can act quickly and they can respond quickly if they are prepared. So I think the priority is really this actors' engagement at the local national level. And that should, so the first round for funding should set up this strong basis that will ensure this engagement to then subsequently fund more long-term technical actions to be implemented on the long run. So this project should be funded to really assess the needs and constraints of those actors. What do they need? Which priorities, and they should not be defined at the international level without having them consulted and engaged, and that is the first step to engagement. But of course, it will be important that the project or the program that are funded priority engage those actors, but also the policy actor, the national level actors, and having all those people discussing around the table from civil society, from technical, from research, and from policy making. Thank you very much.
Thank you. And I have a follow-up questions for everyone here. Based on your inputs, and particularly Marisa's last input about actors' engagement, how do you see networks such as this that we are speaking into, in that this consultation, such as this that connects civil society from the world to be able to share experiences, knowledge, best practices, and hub? Do you think some sort of mechanism like similar to the one that we have now is necessary to be included in the first round of this RFP? Or if I put if I frame the question differently, do you think this setup, this arrangement is something that is beneficial, that you see as a benefit for civil society to connect, engage, and share experiences in the PPR? Please, colleagues, whoever wants to jump in, we will spend the last 10 minutes to discuss this one follow-up question. Ulrich, please take the please take the floor. Thank you.
Je vous remercie.
I want to thank you for this comment. This activity
En application est une innovation.
is an innovation because we haven't have this opportunity for this consultation to mobilize resources and the establishment questions of health in the world level. I think this process is really important to stay interconnected in the regional and national level in a way to work together to establish a paper or guidelines to survey emerging diseases and upcoming pandemics, and the priority is for the PPR 5 to have another social relations really important to engage. We have the capacity to indicate and to influence I think this is really for the local communities regarding our countries. They are countries of limited responsibility, and certain projects would not reach the communities in the rural areas and border areas as well. And like my colleague from Gabon have said, the people in the borderlines of the countries are the most vulnerable, like in Cameroon. And this is a share of pandemic, and it's really not really easy. And to engage and to establish some guidelines, I think I want to thank you all.
Thank you. And Venus, and then Guy. And then to remind everyone, I think we haven't quite answered the how or what should be deprioritized. We still have only a few deprioritized. What would you sacrifice, quote unquote, in this case?
Okay, I just wanted to highlight the issue of having an all-inclusive, all of government, whole of society approach in which talks to how the coordination is done. I think strengthening that from the onset and having an all-inclusive coordination mechanism for pandemic preparedness and response would actually help in how we respond if we prioritize strengthening that system. Thank you.
Thank you, Venus. And then Guy, with interest of time, we are approaching the end of the 25 minutes. So after Guy, if there are no other questions, then I will wrap up the second round of discussion similar to the one we just had after round one. Please, Guy.
Oui, encore merci donc pour
So thank you one more time for this panel. I want to, we have to be sure that the focus, we have focus on the population and to all the resources. The population have to be actors of their destiny, that we can reach the SDGs. And regarding the central decisions, we wouldn't have the main sensitivity of the rural areas and the local areas. So fundamentally, we have local communities. We have to reinforce their capacities and have to be more inclusive and to share experiences and to have the train for the implementation and to establish health programs. Thank you.
Thank you, and thank you, David, for putting in an insight in the chat box. So I will start with that. If colleagues can put up the Jamboard for discussion 2. While we wait for the Jamboard, let me point out to a few keywords that come up during our round of questions. Not for physical infrastructure, not for building new hospitals and that. We should deprioritize global response or COVID-specific response in favor of building health system generally. Those are the two key takeaways that you give to us, what to deprioritize. But what to be put in, what to be included in the second RFP, in this initial RFPs, it should include community surveillance, advocacy efforts. It should be targeted intervention to specific countries, support supply chain mechanism, support multilateralism in order to build support as well at national level for data, whether it's collection or quality assurance that data is available at real time, and of course for monitoring and evaluation. It should include actors' engagement. And to answer the follow-up question that I gave a few moments ago, perhaps this type of setup is also beneficial to have for the establishment of some sort of CSO guidelines, and also to Marisa's point, to be able to critically involve all actors who are working at community and local levels. With that, I would like to thank everyone who participate in this consultation, and please do give okay, thank you, Anna. Your last comment in the chat box. What is still missing from the priorities is intersectorality. This should not be a fund that encourages silos. So not silos, but to address intersections that we are facing as we work in communities and local levels. I again thank everyone who participate and join in this second consultation, and we'll give the room now to Rafa in the third round, not for the questions, but information session with regard to interim CSO representatives in the governing board of FIF. Please, Rafa, the floor is yours.
Thank you, Ibdia. And now let me just go back to the presentation and share with you a bit more information about the global call for nominations for the 2 interim seats for the board. As we heard earlier in the call from the interim secretariat and from the representative of the founding donors, this is a decision that is coming, and under that assumption is that we are putting together also along with this group and with a broader group of organizations, with the ACDA platform, with EANNASO, with CISDI, these global calls for nominations. And we expect that the decision will come soon. And as I said, we're working under that assumption. We have a diverse group of organizations organizing, facilitating this process to be involved, and we're aiming to conduct this process despite its all restrictions, and that we have to be very fast. It's an extremely abbreviated time frame. We aim to conduct it online and also with the highest degree of transparency and accountability in itself. The goal that we have to meet is to have 2 selected representatives by September 8 or 9 when the meeting is expected to happen. So the deadline for the application is this Thursday. So I think we would encourage you to review the information that is available on the website. There you will find the eligibility criteria, the more information about the role, what it is expected about those 2 representatives to sit on the board. And you will find also the information that is being requested to nominate. It is about sharing more information about the candidate's experience, how their CV or their work is relevant to the work or the role that is expected from civil society representative in the board. And I think it's important also to mention that this is a self-nominating form. That means that those candidates that would like to participate have to fill out that information. So even though there might be, so in case you know someone and you believe that that person should be part of the process, that should be representing civil society in the board, I think it is important to encourage them to review the information that is available, to help them to prepare the nomination and then submit it through the online form. The online form is very clear, very specific about how the information has to be submitted. It requests to fill out 4 different questions. One is the statement where the candidate presents the case or exposes the reasons why the person wants to be in the committee. And then the other question explore a little bit in more detail the experience that someone may have on a governing or advisory body, the experience on pandemic preparedness that could be relevant for being part of the board. And our other 2 questions, we are expecting very concise and specific answers. These are limited to 250 words in the statement, and on the other 3 questions to 150 words. All the information will be available in also in the Global Pandemic Hub. There we'll be putting more information about who is part of the selecting committee. So to answer the question from Linda, there will be a selecting committee, and the selecting committee will be integrated by this group of organizations that it's being part of or that is facilitating this process. And we also will aim to bring some others to make sure that it is a diverse group of people running or reviewing the applications and making this interim selection. And they will put more information online on how the guidance that they will be following to assess the different nominations. So please check the form. The form also has a section to send any more specific questions that may come up. Just below the title, you will find a small note that says "Ask a question," so you can send the questions directly there, or you can also send an email to info@pandemicactionnetwork.org. So I'll stop here and I'll open the floor to any questions or comments that might be from anyone in the call. Good. I mean, I see a question from Anna Mary about the deadline. I mean, indeed, the deadline is quite short. We do have to be. I mean, it's an imperfect process. We would love to have more time, but if we really want to meet the deadline and have someone select and review all the applications, I think we will encourage them to meet the deadline, which is this Thursday by 12 Eastern time, which for Asia, Africa, and Europe give us a little bit more time as well. For example, here for Central European time, it would be 6 p.m. And if you just review the form is quite concise, quite specific, and we're expecting that it should be easy to fill out, to prepare the answers. It's not necessary to prepare a lot of information, but to think more about the answers to those questions that are related to the experience and knowledge that the person can bring to the role. Luca is also asking about the expected duration of this interim role. Right now, we are under the assumption that it will be 6 months, and that once the board has been established or the fund has been established properly, there would be a formal nomination or a formal process for nomination process for the formal selection of those permanent representative by the end of this year or the beginning of the next one, so that there is so that the permanent representative can start in April 2023.
Perhaps to make it easier for everyone, I can ask for colleagues to put up the link to the form that we have prepared for CSO involvement. Perhaps Ramadan, can you share the link that we have so colleagues here can download, open it, and be able to prepare their applications. Thank you. There it is, in the chat box. Thank you, Stephanie, to bring that up into the chat box, and everyone can then access the form. To answer Aida's question about the expected time commitment, we see this as an interim position, as explained by Rafa. Perhaps that's until February or March of next year, we do not see yet how much time commitment per week or per month that will that this position will entail.
I have also just pasted as well the link to the survey. This is more on the consultation, so remember that those who would like to provide written input, that's the link that Iputia was mentioning as well. So both links are now on the chat. One referring you to the global call for nominations, and the second link to the survey to keep collecting your input on the questions on today's consultation discussion.
Okay, if there are no other concerns or needs for clarification, I will give the floor now to Eloise to wrap up our consultation. Thank you.
Thank you so much, Ibudia. Thank you to everybody who has participated in this rich discussion today. We heard about the importance of community surveillance. We heard about the importance in the chat of not fighting the last war. There was some discussion also about the focus on prevention, preparedness, response, containment, what the right balance is, what the role of the fifth should be in those pieces. We also had highlighted by several speakers the importance of focusing on the inequities that we need to rebalance. So women, disabilities, vulnerable groups, those that are IDPs, maybe in conflict zones or refugee camps, those that often tend to be forgotten, whether it's preparedness or response. And we had an overwhelming cry for community engagement, investment across the piece, local and national priorities to be listened to and not defined at the international level. So as we think about the fifth and these the focus of the scope, we need to find ways of making sure that whatever the international scope is, it makes sense and can be adapted to local and community and national contexts. And we want no silos, and we want support that leaves a legacy for system strengthening while not losing the particular focus on pandemic prevention and preparedness, which has been neglected for so long, and why we need this fund. So it just leaves me to say a huge thank you to Ibadia for her expert moderating, to all of you for your participation, your active participation in the chat, and a quick reminder that we will be, there is still the link to the survey that you can input into, I believe afterwards. We will be shortly turning this around into a written summary, which we will share with this group, taking all of the verbal inputs and the written inputs of today. Thank you as well to donors that, co-contributors that joined, as well as the Fifth Secretariat. Your input and participation is much valued, and we hope you got a lot out of today, and we will be certainly listening to hear back from all of the different inputs and progress on the CSO seat situation. And just to also say, there were some questions in the chat on the selection process. We have another consultation tomorrow that's more friendly to the Americas time zone. Anything we didn't get to today, we'll try to answer tomorrow, and keep an eye on that link that Rafa posted. All the information will be there. Thank you so much, everybody. See maybe some of you tomorrow. Please spread the word, and we will keep these consultations going and look forward to engaging with you in future. All the best and have a great day.
Thank you, everyone.
Please, want us to get the link again. I didn't get the link for nomination, please. Maybe post it back to the screen so I can get it, please.
Which information, sorry?
I said I couldn't get the link for nomination. Please, can it be posted back on the screen, please?
Post in the chat. We'll send it round as well in the notes. Thank you, everyone. This call is now ending. Have a great day.
Thank you so much.
Merci, au revoir.
Thanks.